Keeping a leech as a pet sounds crazy, but it isn't. They're fascinating, surprisingly low-maintenance creatures that are great for hobbyists and medical specialists. In this video, we're going to explore everything you need to know about leech care, which species are ideal for beginners, and why their medicinal relevance remains strong in today's world of high-tech healthcare. It's important to understand that leeches are aquatic or semi-aquatic annelids, basically relatives of earthworms, but with a more specialized lifestyle. They come in different species, some that eat blood, while other species are carnivorous predators that consume insect larvae, snails, or small invertebrates. Species are also differentiated into warm or cold-blooded, since their feeding requirements and behavior differ significantly. If you're new to leech keeping, start with these species. 1. European medicinal leech, Hirudo verbana. Hirudo verbana has been used in traditional medicine for centuries and is still actively used in reconstructive surgery today. It's one of the most widely studied and readily available leech species in the world. What makes Hirudo verbana a great beginner pet is its hardiness. It tolerates a range of water conditions and temperatures without issue. It also feeds infrequently, about twice a year, which makes upkeep less demanding. 2. The North American medicinal leech, Macrobdella decora. Often referred to as the North American medicinal leech, Macrobdella decora is admired for its striking appearance, featuring vibrant orange spots and iridescent stripes along its body. This species is an excellent choice for beginners who want something a bit more visual. It tends to be more aquatic and active, making it especially engaging to watch in a tank setting. It's also very adaptable to life in captivity and doesn't require special feeding equipment. You can use the same membrane feeding method as with Hirudo verbana. 3. Helobdella robusta, carnivorous leech. This small carnivorous leech doesn't require blood at all. It feeds on live or frozen invertebrates like blackworms, mosquito larvae, and chopped earthworms. It's also one of the easiest leeches to breed in captivity, so if you're interested in observing a full life cycle, this is the species for you. Setting up a suitable habitat is straightforward. A 5-10-gallon glass or acrylic aquarium or container works well for most beginner-friendly leeches, like Hirudo verbana or Macrobdella decora. Make sure to add a secure, tight-fitting lid, as leeches are notorious escape artists and can slip through the smallest gaps, especially if the water level is high. As for water conditions, you'll want to use clean, dechlorinated water. Tap water treated with a chlorine conditioner works fine, or you can opt for spring water as a safer alternative. For Hirudo verbana, the European medicinal leech, the ideal water temperature is between 18 to 22 degrees, 24 to 72 degrees. Macrobdella decora, the North American medicinal leech, prefers slightly cooler water, typically around 16 to 20 degrees, 60 to 68 degrees, though it can tolerate slightly warmer conditions for short periods. The Helobdella robusta, a smaller carnivorous species, thrives in temperatures ranging from 20 to 24 degrees, 68 to 75 degrees, making it more adaptable to room temperature environments. In general, you don't need a heater unless your ambient room temperature regularly drops below 15 degrees. Filtration should be gentle, like a sponge filter, a low-flow air stone to oxygenate the water without creating strong currents that could stress or exhaust the leeches. They don't require UV lighting, but ambient room light helps them maintain a day-night rhythm. Include aquatic plants, smooth stones, and driftwood to offer them places to hide and explore. You can also add some aquatic snails for more enrichment. Leeches are surprisingly interactive when they feel secure in their environment. Watching one swim or crawl with its rhythmic motion is what keeps them interesting to watch. Now let's talk about feeding. Blood-feeding leeches like Hirudo verbana and Macrobdella decora usually feed on animal blood, but there are several safe and hygienic ways to do this. You can use warmed, defrosted blood, bovine or avian, in a membrane feeder setup. This involves placing the blood in a warmed container and covering it with sausage casing or laboratory-grade parafilm. The leeches pierce the membrane and feed through it, just as they would on a host, while some keepers opt to feed them from their own body under controlled, sterile conditions. This comes with medical and ethical concerns and should be done only with a full understanding of the risks. These leeches should be fed 5-15 mimios on a time limit of an hour, and this will be done twice a year. For carnivorous species like Halobdella robusta, their diet consists of small invertebrates like bloodworms, blackworms, mosquito larvae, or even pieces of chopped earthworm. These leeches usually also feed every few months like blood feeders, as it only depends on their size and last meal. Now, a well-fed leech will swell dramatically, sometimes doubling or tripling in size. After feeding, they often hide for several days to digest. Be sure to remove uneaten food to prevent fouling the water, especially in tanks with substrate. Partial water changes of about 25% weekly or biweekly are ideal to maintain water quality. Avoid any detergents or chemical cleaning agents when rinsing tank components. Just use hot water and mechanical cleaning. As for interaction, leeches are more observant than most people think. They sense movement, temperature changes, and chemical signals in the water. Some will approach your finger near the glass or rise to the surface when they sense feeding time. While you don't handle leeches like a dog or a tarantula, they respond to consistency and care. Now let's transition to something that fascinates both scientists and doctors: leeches used in modern medicine. Despite sounding medieval, medicinal leech therapy is very much alive today, and even FDA approved in several countries. The most well-known species used is Hirudo medicinalis, closely related to Hirudo verbana, and it plays a key role in microsurgery, particularly in cases of reattaching severed fingers, ears, or skin grafts. When doctors reattach a severed body part, like a finger, ear, or piece of skin, restoring blood flow is essential to avoid venous congestion. Venous congestion happens when the small, delicate veins at a surgical site, especially in procedures like reattachments or grafts, they aren't able to carry blood away fast enough. While arteries continue to deliver fresh, oxygen-rich blood to the area, the weakened or damaged veins struggle to send that blood back to the heart and lungs for reoxygenation. As a result, the blood starts to pool and build up in the tissue. If this backup isn't treated, waste gases like carbon dioxide begin to accumulate in the trapped blood, and the affected tissue can start to die due to a lack of fresh oxygen and proper circulation. This is where the leech is needed. When applied to the swollen area, a leech will bite and draw out excess blood, relieving the congestion. But what really makes this effective is the leech's saliva. While feeding, the leech injects a special mix of compounds into the wound, including hirudin, which stops the blood from clotting, anti-inflammatory agents that reduce swelling, and anesthetics that numb the bite site. This compound not only thins the blood and keeps it flowing, but it also encourages the growth of tiny new blood vessels, called capillaries, which help reestablish proper circulation over time. In short, leeches give the body more time to heal itself, allowing the venous system to rebuild before tissue damage becomes irreversible. Beyond surgery, researchers are also exploring the potential of leech saliva in modern treatments for chronic conditions like osteoarthritis, heart disease, and diabetic complications. Some of the proteins found in leech secretions have shown promise as natural antibiotics and blood thinners. It's truly fascinating how a creature once used in ancient medicine continues to play a role in cutting-edge healthcare. And here's something that surprises most people. Leeches are sterile when raised in laboratory conditions. Medical-grade leeches are kept in controlled environments and fasted before application to eliminate risks of bacterial transfer. After a medical session, leeches are euthanized according to strict regulations, not reused. While this might seem cruel and wasteful, it ensures that patient safety is never compromised. It also highlights the value of captive breeding programs, both for medical and hobbyist purposes. Leech keeping is one of the most fascinating, affordable, and educational forms of pet care you can explore. With simple tank setups, feeding schedules, and the potential for ethical breeding, they're a manageable and deeply rewarding species for both beginners and experienced aquarists. If you found this video informative, please give it a thumbs up, share it with your fellow nature friends, and consider subscribing for more content on insect keeping, invertebrate husbandry, and all things biological. Drop your questions in the comments. Stay curious.